So welcome to the TKC Smile Design series. So today I'm going to discuss Invisalign and gum contouring. So we provide a lot of Invisalign treatment. It's a very popular treatment nowadays for tooth alignment. We don't just offer Invisalign though, we also offer labial braces, Damon braces and all sorts of other fixed braces. So the advantage of that is not every case is an Invisalign case. So if you only do Invisalign, everything becomes an Invisalign case. But because we do other orthodontic treatments, we're able to help the patient choose what is the most suitable treatment, because certain cases are better with Invisalign than with fixed braces. For instance, correction of anterior open bites is really good with Invisalign, even better than with fixed braces. But with fixed braces, if teeth are really misaligned or malaligned, then having a fixed brace could be much more beneficial because it works much quicker. So we also do combination treatments where we do some fixed braces first to do the gross movements, and then we do Invisalign at the end if the patient requests it. So there's a combination. So in this case, what I'm going to do is we also do Invisalign with gum contouring. So gum contouring is quite a well-known treatment now, and we use a laser for gum contouring, a water laser. And this gum contouring can be very basic, but if it's just one or two teeth that needs the gum margins corrected, if they're not level, or it can be much more advanced if you're correcting a gummy smile treatment surgery. So if someone's got a gummy smile, then we use the laser but with water to correct this by removing the bone as well as the tissue, and that really helps. So we do both. Let's start with this case. So this case, I'm going to just go through what the patient's concerns were and then how we look to tackle it. So the patient's concerns were that the teeth are proclining, which means they're sticking out slightly. Also, doesn't like this tooth nor this tooth sticking out, and also they're asymmetrical. Now, from my perspective, because we offer a full spectrum of cosmetic treatments, I'm looking at this and checking each individual tooth to see how they look, how they compare. Initially, I could see straight away that these two teeth are not your typical lateral incisors. They're a bit wider, they're shorter, and I knew this was actually a problem for the patient without them actually realizing it. So we had a long discussion about this and said, look, I can fix this with Invisalign, the alignment of your teeth. Now, why we chose Invisalign? Because alignment for this type of case, Invisalign is totally fine. It's not going to be too difficult. It's going to take about 3 to 4 months just to get these teeth aligned. But what I also knew is once these teeth are aligned, these two teeth will become a problem because they are not the shape that the patient wants. So the discussion then was, what do we do? How do we fix that? So how we fix it? Well, we've got two options. We either do some composite bonding or we do ceramics. So both options were discussed with the patient. The patient opted for composite bonding just to get these teeth to look more like lateral incisors rather than what they look like now, which is very rounded but short teeth. So again, you can see from these pictures there's quite a bit of proclination. So Invisalign is quite good at improving that. With some attachments onto the teeth, we're able to pull the teeth back in, close the spaces up slightly, and you can see here this tooth was really sticking out. It bothered the patient quite a lot. So we were able to fix that relatively easily with the Invisalign. It only took 3 to 4 months. And then at the end of the treatment, what we were able to do is a bit of composite bonding on each individual teeth. And I'll show you this in more detail here. If we look at here, so we were able to do some composite bonding with some little bit of laser recontouring. And the patient was very happy because this was actually one of the big issues, was that the teeth were actually looking quite short. So we were able to correct that. The other way to tackle a case like this would be to have done some non-prep ceramics. Because the teeth are quite short, you could do some ceramics, which we do a lot of, and bond that on top. The advantage of that is that they just last longer and they look a bit more aesthetic. But in this case, composite bonding as a young patient worked absolutely fine. So you can see here the close-ups of the teeth. The composite bonding looks super natural, and we literally, it's just all addition. We don't take anything off, we just add to the tooth, and it just looks very natural. So it's a nice way to show how we can get a correction in alignment and then we build the teeth up to make them look more natural and match the other side. You can see lots of natural translucency here in the patient, which is so nice, and we were able to recreate that with our ceramics by using some very translucent composites, not ceramics. With ceramics, we're able to do the same thing, probably even better, just because ceramics reflect light even better than the composite resins. But nowadays, the composite resins are also good, so we still were able to create some nice translucency within this tooth. You can see it here, translucency here, it's nice. And the patient did have some whitening at the end of the treatment, so this just shows you the before and after from a side view, so you can really see what we were able to do. Tuck the teeth in, give a nice alignment, bit of tooth whitening, and yeah, it's a nice simple case.